Hi, this is Dr. Jerica Kirkley. My pronouns are she, her, and hers. I'm a trans woman, a physician, and the Chief Medical Officer and co-founder of Plume. So this injection video will walk you through all of the supplies, the steps, and the safety measures necessary to give yourself an injection. But before we get into those details, let's just take a step back and recognize that it can be a little daunting to have to give yourself an injection. Even myself as a physician, somebody who's injected many other people, and myself many times, I still feel it a little bit every time I'm about to go to give myself that injection once a week. But let's also recognize it can be a really exciting time, right? An opportunity to really take control of your gender affirmation journey, to be an active participant in the process. And of course, we at Plume, your care team, are always available for you. Just get a hold of us in our secure app. So before we get started, let's all take a big, deep breath together. So we're going to close our eyes and breathe in through our nose and out through our mouth. And I also want to say that you are valid, you are loved, and we support you no matter what. You can do this. The first thing we have is the vial of medication itself. For me, this is estradiol, and both estradiol and testosterone are suspended in a thick oil. So everything we talk about today applies for each. And you want to store your vial of medication in an area that's room temperature and also not exposed to light. So up on a shelf in a closet is a great place to put it. That's where I put mine. Another thing with the medication you always want to check for before you give it is that it's clear. And so you can do this just by holding it up to a light source, looking through, making sure it's clear, there's no debris floating around. And the next thing you'll need is a syringe. This is a 1 milliliter syringe, or 1 ml. And this is what we're actually going to use to draw up the medication and then push the medication into our bodies. And it's what attaches to the needles. I do recommend a 1 milliliter syringe because it's a lot easier to see the individual 0.1 milliliter markings, and especially if you're injecting lower doses. A lot of pharmacies carry sometimes only a 3 milliliter syringe, and so if you can ask them to order a 1 milliliter syringe, that always works a little bit better. So I just want to bring your attention to two types of syringes that are out there. One is called the Luer lock syringe, and the other one is the Luer slip syringe. So the Luer lock syringe actually has these little threads on it where the needle locks into place. And so that prevents the needle from moving once it's connected to the syringe. The Luer slip syringe just has a smooth end to it, and the needle slides into place. In our case, we do recommend a Luer lock syringe. This way you can firmly lock the needle in place. Make sure that it's not going to move during the process of drawing up or injecting. So you want to make sure that when you go to the pharmacy to pick up your syringes that it is a Luer lock syringe. The next thing we have are our needles. And so this first needle I have is what we call our draw-up needle. And so this is an 18 gauge needle. Now, the smaller the number, the larger and wider the needle is. And I do recommend an 18 gauge needle because it draws up the medication a lot quicker. You can probably use anywhere from an 18 gauge to a 22 gauge, but I do like to use an 18 gauge needle. The next and final needle we have is a 23 gauge needle. So this is our injection needle. This is what we're actually going to put into our skin to deliver the medication. Again, smaller number means a larger, wider needle, and a larger number, or a higher number, means a skinnier needle. And so I think a 23 gauge needle is a nice balance of being small enough to where it's reasonably comfortable, not too painful, but also big enough to deliver the medication quickly so it doesn't have to stay in your skin for a long time. Next thing we have is just your basic run-of-the-mill cotton pad, or you can use a cotton ball as well. Just something to have nearby to put on the leg as soon as you take the needle out. Next we have 2 alcohol swabs. So we're going to use one of these swabs to wipe the vial with before we draw the medication out. And we're going to use the other alcohol swab to swab our skin and make sure everything's clean before we actually give the injection. Then we have a bandage. This is what you'll put on the site where you give the injection as soon as you're finished. I do recommend a children's bandage as it adds a little bit of fun in this process. Then we also have our sharps container. And so this is really where we're going to put our needles as soon as we're done. You do want to find something that has rigid sides and that can be closed to keep it safe from anybody else. This is a medical grade sharps box. You can find these online for probably $5 to $10. But you can also use just your basic household items such as a laundry detergent container, perhaps a kitty litter container, or maybe even an orange juice bottle, just anything that has hard sides and can be closed. And last, we have a towel. And this is really just to drape under you, maybe if you're sitting on a couch or to put on the floor, in case there's a small amount of bleeding during the injection. So let's talk about how to prepare your vial of medication. So both estradiol and testosterone, as I mentioned, are suspended in pretty thick oils. So one thing that can be helpful is to warm up the vial slightly, just to enable the medication to be delivered a little easier. And you can do that simply by rolling the vial in your hands 5-10 times back and forth, again, just to warm it up a little bit. Now, another way you can warm up the vial is just to run it under warm water in the sink. With testosterone in particular, it sometimes gets crystals in it when it gets too cold. Just make sure to not ever put it in boiling water. So the next thing we're going to do is take the cap off of your medication vial and swab it with alcohol. So you can see on mine, because I've used it before, it doesn't currently have a plastic cap on it, but if you were just starting to use it, it would. And you can simply take your thumb and pop off that plastic cap. You can see underneath, you'll see the vial itself and also a rubber stopper, and that's exactly how it should look. Tear open our alcohol swab just like that, and you're just going to hold the vial gently, put your alcohol swab on top, and rub it for about 10 seconds, getting all that bacteria and dirt off. And now your vial is ready to be injected. So the next thing we're going to do is prepare our syringe with the medication. So you'll see we have our 1 ml syringe and our 18 gauge draw-up needle. So the first thing we'll do is remove the syringe from the packaging. And there's this already open just a little bit here when you get it, and you're just gonna pull that back. Now we always wanna make sure we're keeping the end of it where the needle goes clean or sterile. So we'll pull this out and keeping that end away from us. Now you're gonna take your draw needle. It's also has this little tab here, just like the syringe. And we're gonna peel that back just so we expose the hub of the needle. And so now we're going to take our syringe and just put it onto the hub and twist and lock it into place, just like that. So the next thing we're going to do is remove the plastic from the cap of the needle. We'll grab the cap down towards the base of the needle, twist it one more time firmly, just to make sure that it's locked into place. The next thing we're going to do is prep our syringe before we actually insert it into the vial of medication. So to do that, you're simply going to pull back on the plunger. And for my injection, I'm going to give 0.2 mLs. And I always recommend to pull back a little bit more than what you're actually going to inject. So in this case, we'll pull it back to about 0.5 mLs. So now we're ready to draw up our medication. So we'll remove the cap. You can see the vial is just sitting down on the table. And we'll hold the syringe just like we're holding a dart. And hold the vial, and we'll put it right through the rubber stopper. And now we're going to turn this whole thing upside down. So you'll see I put the needle all the way in. So you want to pull that needle back just a little bit so that it is well within the fluid and not above the actual level of the medication. So now we're going to pressurize the vial so that it makes it easier for the medication to come out. So we're going to push all this air into the medication that we drew up before. You can see little air bubbles coming out of the needle. And we'll just push that all the way in. And now we're going to reposition and just pull back on the syringe. And now you can see medication starting to fill into the syringe. And so it's totally fine to just keep pulling back more than what you actually, again, are going to need to inject. And you'll see there's little air bubbles in the medication itself in the syringe. And so to get those out, we can just kind of tap it a little bit. and let those float to the top. And then we'll gradually push the medication back into the vial until we arrive at the actual mark that we want to inject with. And again, we can see those air bubbles just moving up. I'll give it another flick just to make sure they're right at the top. And I'm drawing up to 0.2, so I'm going to move the stopper until it gets right to 0.2. And now we're ready to remove our needle from the vial. So we'll flip it back over onto the table, and we'll pull this out of the rubber stopper. And the next part is we're going to recap this needle. And so you just have the cap in front of you. Remove your hand so it's clear of the needle, and slide the needle right into the cap. We'll flip it up like this, and now we can press it firmly in place. And we'll remove this needle by grabbing down at the base of the needle and twisting the opposite direction that we did to attach it, and drop it into the sharps box. And now the last thing before we inject is just to put our injection needle on. So being careful not to touch the end of the syringe, we're going to open up our injection needle. Same thing as before. Insert this on, twist it. We'll pull this plastic wrapper off. Again, grab the cap of the needle right near the base of the needle. Twist it just a little bit more to make sure it's securely locked into place. And now we're ready to actually give the injection. So when you're getting ready to give yourself an injection, it's important to be comfortably seated. Nice to have your leg bent at a 90-degree angle, which keeps your leg relaxed, keeps your muscles relaxed. You also notice I put down a towel just in case there's a small amount of bleeding so it doesn't get on your couch, your chair, or your floor. For intramuscular injections, for both estradiol and testosterone, we want to use a muscle called the vastus lateralis, which just runs along the upper outer portion of your thigh. We like this area and recommend it because it is the safest area to inject intramuscular in the body when you're giving yourself an injection, meaning that it avoids major blood vessels and major nerves. Also, something that's helpful is to inject on the leg that matches with your dominant hand the first time that you do it. So I'm right-handed, and you'll notice I injected on my right leg. It just makes it a little bit easier as opposed to having to cross over and remember all these steps when you're doing it for the first time. To find the actual spot you're going to inject, we use what we like to call the three-handed method. So if I'm injecting on my right leg, I'm going to take my left hand first, place it on my kneecap. Then I'm going to take my right hand, just on the other side of it, and then take my left hand again and put it on the other side of my right hand. Now, I like to use the space between my pointer finger and my middle finger for where I'll put my injection. And you can simply take a pen that's retracted or your syringe that's prepared with the cap on the needle just to mark a target where you're going to put the needle right between those two fingers. Press in gently, and then you've made a nice little target where you know to put your needle. All right, and the last thing before we actually inject ourselves is to make sure we clean the area where we want to inject. You can see our little target spot is right there. So I'm going to take one of our alcohol swabs, open it up just as before, and we start right in the middle on that target. Small circles moving outwards and try not to go over the same area as before. And now our area is appropriately prepped. So now we're going to explain how to do the Z-track method. And this is just a way of prepping the skin or pulling on the skin so that it moves the top layers, or what we call the subcutaneous layers, over the muscle so that after you put the needle in and then take it out, it'll actually move the skin layers back over the hole that went into the muscle so that the medication stays in the muscle. So you'll take your non-injection or non-dominant hand, place it in front of the target that you made. You're going to pull the skin forward. You'll insert your needle, push in the medication, keep pulling that skin forward the whole time towards your knee, pull your needle out, and then release the skin. All right, so now we're ready to do our actual injection. So we're going to bring our needle over to our area that we've previously prepped, and we're going to be pulling our skin towards the knee, performing the Z-track method as we described. And you can see I'm holding it just above the skin, right over the little target that we made before. We're positioning the needle at a 90-degree angle to the leg. And so when we insert the needle, we're going to push it in a nice, smooth, easy motion. Just pushing the medication in, nice, smooth action. We'll pull the needle out, release the skin, and now we'll grab our cotton swab. Little amount of bleeding, which is very common. And we'll hold that for a few seconds until it's all done. And once the bleeding has slowed down, then we can remove our cotton swab. And we'll grab our bandage and put it right over that little spot. And we're all done. So now that we've completed our injection, we're going to want to recap this needle. And we do that the same way before with the 18-gauge needle. Just slide it right into the cap. We're going to flip it up, make sure it's secure, and then we can twist this off the opposite direction. And we're going to drop it into our sharps box. So once your sharps container is full, you want to make sure you properly dispose of it. To find out the proper guidelines, you can go to safeneedledisposal.org. The next time you give your injection, you want to rotate your injection site. So if you did it on your right leg this time, then you'll do it on your left leg for the next week's injection. So a lot of people ask if you need to aspirate when you're doing a gender-affirming care injection. So the technique of aspiration is when you've inserted the needle and then you pull back on the plunger of the syringe to see if any blood moves into the syringe before you actually insert the medication. Now, the idea to do this comes from wanting to know if you have accidentally inserted into a significant blood vessel. But with gender-affirming care injections, whether you're doing subcutaneous or intramuscular, we're specifically picking areas that don't have major blood vessels that you could enter into. So this would be extremely unlikely. And the medications themselves, even if they happen to go into a blood vessel, do not cause significant consequences. Now, they've actually studied the need to aspirate or not in multiple studies, including with children, and the recommendation has come out that you do not need to aspirate, because largely this causes a longer time that the needle is in the body, could produce more trauma and more pain in the injection process. And therefore, we do not recommend aspirating while doing these injections.